Alright guys, so we're going to talk about renal artery stenosis. So whenever we're talking about whenever we're talking about hypertension, most of the times we're focusing only on the heart or the cardiology aspect, but most of the hypertension we have to focus on the kidney as well. Okay, so there are 90% of the cases of hypertension is due to idiopathic. We don't know the cause exactly. This one is primary hypertension, and the 10% of the causes are the secondary causes, which includes due to some tumors or due to some drugs. Okay, or renal artery stenosis. Now, what happens is this: you have the two blood vessel, one blood vessel going into the kidney, and one is coming out. The one which is going to the kidney is called the renal artery. You can see the renal artery here. This is the renal artery, and you have the renal vein which drains out the blood. Anytime there is stenosis, okay, anytime there is stenosis. Now, what is stenosis? This lumen, right? This lumen. If this lumen, this artery, the lumen inside the artery is reduced. There is stenosis. What is the meaning of stenosis? To become smaller. The amount of blood going to the kidney will reduce. And when anytime this happens, the kidney has a defense mechanism. The kidney thinks that you are in dehydration, or you're in shock, or you are having an trauma. What happens in trauma? Most of the fluids have been released. Most of the blood has been gone out. So your volume of blood is reduced. So volume of blood going to the kidney is also reduced. So in this case, the kidney activates an pathway that is called this RAS activation, in which the kidney will start to conserve sodium. Okay, so anytime the sodium has been conserved, water follows the sodium. So where the body is conserving sodium, so the water is also been conserved. Okay, the kidney thinks there is hypovolemic shock, there is trauma, there is dehydration, but actually there is no dehydration. There is a problem in the artery, right? So body is going to body is going to retain sodium. More amount of sodium means more amount of fluid. More amount of fluid means more amount of blood volume. More amount of blood volume means high amount of blood pressure. Okay. So anytime you are giving medication for reducing blood pressure, this will not work. So this is called as resistant hypertension. So that means there are various categories of drugs which we give in hypertension. So resistant hypertension means 3 or more different type of class of drugs you are giving, out of which one has to be a diuretic. Okay, diuretic means throw out water and sodium. So giving 3 or more than 3 drugs that is not helping is actually called as resistant hypertension. Okay, so in this case, how do you suspect this case? You have given the drugs, it's not working, so you do a renal Doppler. Okay, in renal Doppler it is generally done by radiologist. So you will be able to see the lumen of the artery has been reduced. So once the lumen of the artery is reduced, what we do is that we put a stent. It's very simple. Stenting is put in order to reduce the clot or reduce the increase the size of the lumen. So simple thing, you put a stent, the blood flow goes to the kidney, becomes normal. The body doesn't try to compensate, so the blood pressure comes to normal thing. Okay, so generally we say Doppler. Doppler means in very simple words, the blood vessels are there. So blood vessels in the body are called as veins and artery. So if we are doing a Doppler for the vein, we will say a venous Doppler, or if you're doing for an artery, we will say it for arterial Doppler. Arterial Doppler will do it for patients with old patients, male patients who are having a history of smoking. So we suspect a peripheral vascular disease. If you see the pulse will be reduced. So we suspect in that cases, we will do an arterial Doppler. Whereas the venous Doppler, we will do in varicose vein. Very, very commonly we will do in varicose vein. Okay, so what we will see in this Doppler, we'll try to see the is there any thrombus, or we'll try to compress the vein, or we want to see the flow, how is the valve in the vein, or how is the patency of the vein. So this is the things we are going to see in the Doppler, venous Doppler, right? So again, peripheral vascular disease, we'll do an arterial Doppler. Anything like varicose vein, we'll do in venous Doppler. And once you remove the obstruction here, the amount of blood flow going to the kidney turns out to be normal. So the RAS activation stops, and then body is working perfectly fine, and the blood pressure comes back to normal. You treat this cause, the blood pressure will come to normal. Don't treat this cause, give no matter what drugs you give, it's not going to work. Okay, because the body is going to compensate like crazy. So this is a defense mechanism by the body, but in this case, this defense mechanism is working against our own body. Okay, so this is a renal artery stenosis. And if you, by clinical examination, sometimes we might able to hear the bruit if we use the Stethoscope near the renal artery. Thank you.